All right, good afternoon, everyone. My name is Jeff Cooper, Health Commissioner at Public Health Dayton, Montgomery County. Thank you again for being here today. We are joined again by Mayor Nan Whaley with the City of Dayton, and we also have Michael Doan, MD, Public Health Medical Director here in the event that there are medical questions. So regarding reopening the economy, we've observed what occurred on May 1st with healthcare, dental services, and veterinary services resuming. May 4th led to manufacturing, distribution, and construction, along with general office environments. And now today, May 12th, we have consumer and retail and services that are reopening. We understand that this coming Friday, May 15th, restaurants and bars will be able to have outdoor dining and patios. Also, personal services again resume on May 15th. So hair salons, day spas, nail salons, barbershops, and tanning facilities. And then we just learned today on the Governor's News Conference that massage begins again, massage therapy, as well as tattoos and body piercings. And then May 21st, restaurants and bars can begin with indoor dining again. It's important to remember, though, that there are a variety of continued closures and the other orders still exist that the governor has issued. So schools are still closed, child care obviously still closed, senior centers, social clubs and country clubs, as well as places of public amusement are still closed, fitness centers, day camps, swimming pools, and spectator sports. Keep in mind also that yes, there are more and more businesses that begin to restart and reopen, but there are a variety of advisory groups and committees that are still in place at the state because this is not complete return to normal business operations. And as we monitor the health impact data and our indicators, in the event that we begin to see a significant spike in cases or hospitalizations, it may lead to reversing some of these restarting and reopening decisions. So at the state level, there's a personal services advisory group, restaurant advisory group, and that stays in place, casinos and racinos, which are not open yet, travel and tourism group, the fair board advisory group, outdoor recreation, gyms and fitness centers, as well as large venue advisory groups, and those will remain in place. There are representatives from each of those respective sectors on those advisory groups, as well as participation from local health departments to make sure that we're balancing the economic decisions with the health implications. So there are some key public health messages that we'd like to give today. First of all, as we begin to reopen the economy and more businesses now restart, especially restaurants and businesses and the retail sector, we will see an increase in cases. We've been saying that for the past multiple months, and so we strongly expect that we will see an increase in cases as the economy restarts. And so public health is working hard to develop its long-term plan for identifying cases and then doing contact tracing. We want to be able to quickly respond regardless of the venue to be able to isolate ill individuals and then identify individuals who were in close contact with those individuals and make sure they are quarantined for 14 days. So as we're all aware, there are protocols in place for all businesses. One of the key is that employees at businesses are required to wear face coverings. Yes, there are some exceptions, and we all understand what those are. So if there's a medical reason, if it's not an industry best practice, or if it's specifically prohibited based on the nature of the job, a face mask or face covering is not required. But by and large, those are the exceptions and not the rule. Most employees do qualify for needing to wear a face covering and are required to do so. So the public should also wear a face covering, and we've been saying that since we first heard from CDC and the Ohio Department of Health that they recommended that the public, when you're in the public, should wear a face covering. It's the right thing to do. We all need to make sacrifices and take appropriate actions to protect each other. So please, as you're circulating again with these businesses that restart, please make sure that you don a face covering to protect the employees within that business. So most of the protocols obviously are common sense. Employers need to make sure that ill employees stay home and they don't return to the work environment until they pass that designated time period, and we've all seen those on the respective guidance documents. Businesses should be limiting the number of customers in their stores. So make sure they're providing for social distancing, and then in the event there are options that are available to many businesses regarding contactless payment. So to the extent possible, minimize contact with various surfaces. And I think it's also really important to stress that, yes, retail is opening back up, but this is not a time to be mingling and gathering long-term for multiple hours in stores. Identify specific items you want, select those items, and then exit. This is not a time to do social browsing, shall we say, and spending multiple hours in any retail establishment. Along those lines, though, you will know as a customer immediately when you enter into a business whether or not they are complying with the order and the social distancing requirements. We've all been talking about this for multiple months now, and it is intuitively obvious to all of us, no matter what environment we're in right now, whether or not social distancing is in place and whether or not that business is taking the appropriate actions to protect you as a consumer as well as their employees. So our recommendation to the public would be support and visit those businesses where it is very obvious that they are taking this Stay Safe Ohio order very seriously. So public health, we'll be out in the community providing guidance to retail as well as restaurants and bars as they begin to reopen. Our staff are also, our environmental health staff actually have statutory responsibility to enforce the food code. So we will be working directly with restaurants and bars as they begin to reopen. And then for all businesses and retail, public health staff will be doing unannounced visits to those locales in the community over the next multiple weeks, etc., to make sure that we're able to guarantee that those businesses are complying with the Stay Safe Ohio order and that they're doing everything possible to enforce the social distancing requirements. So our staff will be visible. They'll have their emergency preparedness vests on, and they'll be working with the community and businesses to make sure that we're keeping everyone safe. So with that, we would like to turn it over to Mayor Nan Whaley.
Thank you, Commissioner Cooper. So I just have a couple of comments today. First, I'm sure you all saw the press release where we've announced the canceling of the July 4th, which we have on July 3rd, fireworks. I want to thank Marion's Piazza for always sponsoring this, but this is just an example of something we'd like to have in the community. There's simply no way that we can ensure that social distancing would happen. If you head to Monument Street or over the bridges on the 3rd of July, there are thousands upon thousands of people. So many cities across the state and across the country have had to cancel their fireworks. Dayton is not any different. I know that people are excited about the possibility of eating out again soon and spending time with one another. I know if you see me around the city, you typically, before this, you would see me at different restaurants. With my husband and I, we pretty much ate out every single evening, and also went to many coffee shops across the city, and know most of the owners of most of these locations, and certainly feel for them on what they've been through and the excruciating decisions they're making right now about what's comfortable for them and their North Star around how to keep their employees and the customers that they love so much safe. I've talked to many of them personally. I just have to say, and I said this when the governor did his order last week, that just because something is allowed doesn't mean you should do it. And considering where we are right now with testing in this community, the data just does not seem to bear out that we should be opening restaurants. I know they're completely allowed to. Commissioner Cooper is going to enforce this. I appreciate that. But I still want to encourage people to stay home and just order takeout until we have our testing and tracing regime at scale here in the Dayton area. Now, last Friday, I went to Children's Hospital, saw the amazing work that Dayton Children's is putting together to provide 10,500 tests every week just for the community as we work on hotspots and allow public health to do that work. I'm really, really grateful for Dayton Children's team. The amazing, I mean, just completely amazing, Commissioner. I don't know if you've had the chance to go over there, how quickly they're getting that up to speed, but it will not even be ready till May 18th for its first test, and it really, I believe, at least a week for it to get going. And keep in mind, patios are now able to open on May 15th, according to the order. So you will not see my husband Sam and I out in restaurants when they reopen. And I cannot encourage any kind of gathering, and frankly, in good conscience, when I know where we are with testing in this community. Let me just kind of explain, and maybe Dr. Doan can do this a little more. What happens is if someone does have COVID and goes and sits at a restaurant, and then a few days later they don't have symptoms but find out they do, then they have to tell that restaurant. And right now we just don't have the testing in place to be able to check everybody out, and so that puts a great amount of stress on the business owners that are having to do this work and the employees that are having to serve every day. Because of this, the city will not be issuing new or additional outdoor seating permits to coincide with the reopening of restaurants on Friday, May 15th. Now, I know I've seen other cities that have done this, that have closed streets, that are offering this, and as a great urbanist, I think it's really great, but I don't know what their situation is with testing. I just know what our community situation is with testing, and I can't, after talking to the city manager, we can't in good conscience say we want to encourage that, because really we want to encourage everyone to continue to do takeout. We will also not approve permits that will allow restaurants to use parking areas or other areas typically utilized by vehicles. So they can open on May 15th in the patio space that they have available today. Now, we're going to revisit this policy in early June alongside our partners at Public Health. We look at the data, we listen to Dr. Doan and Commissioner Cooper about how much testing we have and make those decisions on whether or not it will be safe for people to begin to gather in that way. This will be in Dayton, because of our testing being so slow to ramp up, will be a slower moving effort, because our focus, this is not a false choice for us. This is not about open the economy or people get sick. We want to open the economy safely and make sure people stay healthy at the same time. I know that this is frustrating for some, and I believe we must look out for public safety first and foremost. I know the people of Dayton can hang on a little while longer because they are amazing, and continue to look out for one another from afar, and continue to support small businesses that are providing takeout. There are some amazing ones out there. I also just want to personally say how much I am moved by the restaurant owners that have contacted me that are truly wrestling with this decision. It gives me such a warm heart, and just so incredibly appreciative of this community and its small business leaders as they've been really struggling with these decisions, and just how much I appreciate how much they care for their employees and how much they care for this community. It's a sight to behold, and why we're so lucky to live here in Dayton. I'll look forward to your questions.
You guys have any questions, sir? Yeah, I have a question for Mayor Nan Whaley. As the Montgomery County apparently has been given $92 million of allocations as a result of the CARE Act, why does the city of Dayton need the relief funding ASAP?
So the money that the county received, the $92 million, is very strict. So it has nothing to do with the revenue loss that the city of Dayton or other communities across the state have received. So for example, there is the health disaster, which we're talking about, and that CARES money is for public health and contact tracing and all the things that the county needs to do. Also, it can be used for rental assistance or homeless efforts, all really important to our community. But that money can't be used for the loss of revenue the city of Dayton is experiencing because of the economic issue that we're going through. So CARES was very specific in CARES 3 that it was about those issues around the COVID disaster, not the economic disaster that we're seeing.
Okay. So how are you going to be able to, we get that, try to rephrase my question here. How would you allocate the relief funding if given to Dayton?
Well, the 92 million?
Yes.
Oh, well, I wish I had the 92 million. You need to ask a Montgomery County Commissioner what they're going to do with the 92 million.
Okay.
We're not receiving those funds.
Okay.
The city of Dayton, that's one of the issues. It went to the county, it did not go to the city. Okay? Any other questions?
Anybody on the phone? Anybody on the phone have a question for us?
Great.
You guys still there?
Still here, but no questions.
Okay, very good. Thank you, everybody.
Thank you, guys.
All right.